You mentioned that you're pregnant now, and this is your rainbow baby. This is the pregnancy after experiencing a loss. You had a stillbirth last year. And first of all, my heart goes out to you, and I hope the very best for you this time around. But you mentioned that you're feeling anxious, and of course that's to be expected and very normal under the circumstances, but you're wondering if there's anything else you can do besides taking medication. I suggest starting by talking with your OB provider about the anxiety that you're having because, of course, like I said, it's normal to have anxiety, but if it's mild, it might be able to be managed with coping mechanisms that I'll discuss in a minute. But if it's severe, then that may require medication and or therapy, and that's not something to be afraid of or to shy away from. So talk with your doctor and they can help you decide what's most appropriate for you. Another discussion that your doctor can have with you is about measures that are being taken during this pregnancy to have a better outcome. For example, they can discuss possible causes associated with your previous loss, and if anything can be done to mitigate those risks or to help you have a better outcome this time, then of course they're going to want to help you do that. They can also discuss additional monitoring that will be done during this pregnancy to watch things a little more closely, and they'll tell you about interventions or specialists that might be looped in to help make sure that you have a good outcome this time around. If you don't feel like you need, or if you don't choose to seek professional help from a counselor, for sure make sure that you surround yourself with people who are supportive in your life, people that you can trust and talk to frequently about your feelings. You might want to look for an online support group and talk with other women who have experienced the same thing. And by sharing your feelings and not just, holding them up inside, it can help you cope with them and help you see things from a different perspective this time around. Make sure that you're sleeping well at night. And, that can be funny to say if you're having a lot of anxiety and it's keeping you up at night. You need to do something about that so that you can sleep, because anxiety and depression are, of course, made worse by sleep deprivation. And so this would be another reason why talking with your doctor would be a good idea if it's making it so you want to sleep all the time, or if you can't sleep at all. Those are both extremes that need to be managed. Another thing to think about is how you're going to handle unwelcome conversation. For example, if someone says to you, "Is this your first baby?" How are you going to respond to that? Because it's not your first baby. And some people, I've helped a lot of women who have had stillbirths, and some embrace their experience and make it their own and treat them as if their baby is still a part of their family, and they speak openly about them. Others tend to shy away from the conversation and to act like it never happened. And, I think whatever coping mechanism you choose is up to you. And of course, there's some people that you're going to want to discuss it with and others that you won't, but you should be prepared for these conversations. Take it day by day and make short-term goals. For example, at the beginning of pregnancy, it's easier to say, okay, I want to make it through the first trimester. And then after that, I want to get to that 20-week ultrasound. And then I want to get to viability at 24 weeks. And then I want to get to the beginning of the third trimester. If you set your eyes all the way at the end of the pregnancy, sometimes it can seem too far away and too unachievable, especially if you feel like you're drowning in anxiety. And be prepared for that time when the gestational age is going to roll around, at which you had the stillbirth. That's going to be a hard time. And so make sure again that you're surrounding yourself with friends and family, and that you're not alone on that day, because it will be difficult when that comes around. When it comes to preparations, it can be really hard to look ahead and want to get things ready for this baby because you're afraid of loss again. And, if you have a good day where you're not feeling very anxious, then allow yourself to go buy a few things for this baby, or to get the baby's room ready and pull things out that maybe you have left from your last baby. A journal is really helpful in recording your feelings. It's something that you can reflect back on when you have both good days and bad. The things that you've experienced in the past can be a strength to you in the future. And along the same lines as memory, one of the things you might want to consider is finding a new doctor and a new hospital to deliver at if that's possible for you, so that you can make fresh memories with this pregnancy. Again, I hope the very best for you. And if you have any more questions in the future, don't hesitate to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.